Hello, beautiful. If you are on this video, chances are, if I had to guess, you are getting ready to have an explant surgery and you are considering an explant surgeon and you are on your way to your consultation and you're wondering, okay, what are like the most important questions to ask my surgeon? And when I ask those questions, what do I want to hear? We want to make sure that out of every surgery we're ever going to have, especially if you're dealing with breast implant illness, that you're going to do this surgery right. It's going to be done safely and it's going to be done by one of the best explant surgeons that you can get your hands on. So in this video, I'm going to go over like the top 10 questions that you're going to want to ask your explant surgeon. And then if you do want the full list of questions, I'm going to show you where to get them. But before we get into today's video, if you are new to my channel, welcome. My name is Christina. I'm the founder of Size Happy, the admin of The Best Facebook group on Facebook, Breast Implant Illness, Rejuvenation, and Education with Christina. I'm also the creator of the Breast Implant Illness Healing and Detox Program, the BII Bridge. And you can also find me on Instagram at I am Size Happy. All right, now that we got the intro and the introductions out of the way, let's get into what I think are the top 10 questions to ask your explant surgeon that you are considering and what you want to definitely make sure that you hear back from them after you ask these questions. So the first one would be, are you a board certified plastic surgeon? They should say yes. And you want to make sure that they are board certified because that just means that they have all the schooling necessary and they took all of the classes and the training necessary to perform this type of plastic surgery. The second would be, do you have any photos or testimonials I can take a look at? I think it's really, important for me to see their work because yes, they can do your explant surgery properly and safely, but like, what if the results all look the same and they don't look good, which can happen. So I would definitely suggest during your consultation to say, hey, do you have any photos, like before and after photos of explant surgeries that I can look at just to kind of like get an idea of your work and how I might aesthetically look after explant. The third question, how many explants have you done? Like how many years have you been doing explants for and how many have you done? I would personally love to hear like at least 100. Some of the best explant surgeons do about 3 explants a day. So they're doing at least 10 a week. So you definitely want to hear like they're doing a lot of explants and they could do it with their eyes closed, although you wouldn't really want that. You just want to make sure that they're really experienced with doing explant surgeries because it is kind of like a specialty surgery and you want to make sure that it is getting done right. Number 4, I'm going to kind of combine these two, number 4, number 5. So do you remove the implants en bloc? And do you do a total capsulectomy? I have a whole video on the difference between these two techniques, but you want to make sure that they do your explant surgery en bloc and that they will do a total capsulectomy. And just briefly, what this means is that when they do remove your breast implants, they're also going to remove the capsule from around your implants at the same time. So everything's just going to come out together because you want that capsule around the implant, especially if you know that you have a rupture, because that capsule is just going to case in and contain everything, all the chemicals, the whole implant. It's going to keep everything in there. Now, if they were to potentially cut open the capsule and you had a rupture, no bueno. So when you do ask, do you do it en bloc and a capsulectomy, you want to hear like a confident, yes, that is how I do it. That's how I believe we should do it. And especially again, if you have if you have a ruptured implant. The next one is, where are my incisions going to be? I feel like this is just a really important question because it's just going to give you clarity and peace of mind knowing, okay, when you remove my implants, Am I getting a lift also? Like, where are the incisions gonna be? Are they just gonna be underneath my breasts? Are they gonna be also up my breasts, around my areolas? You know, just to kind of feel it out so that you have no surprises. The next question is, do you use drains? And how long do they usually stay in for? Drains, if you're in the breast implant illness community for long enough, drains is a pretty controversial subject. Some surgeons don't use drains. They don't believe in them. They don't think they're necessary, whereas other surgeons think they're absolutely necessary and that it's a good idea to get all of that fluid out of your body instead of depending on your body to absorb all that extra fluid, right? So again, just to kind of have peace of mind and to know what to expect with your explant surgery, do you use drains, and how long typically do you see your patients like keeping them in for? It should be anywhere from like 3 days to like a week typically, is how long drains should stay in. With all this being said, I do want to mention before I forget, I do have 2 videos on here that I would suggest watching after this one. The first one is how to choose the best explant surgeon, and the second one is everything you need to know about explant surgery. And these videos will just give you a really good idea about like how to choose the best explant surgeon, like what to look for in them. And then the one about explant surgery is like how a typical explant goes from anesthesia to recovery. And again, I'm just somebody, I love peace of mind. I love knowing what to expect. I don't like surprises, especially when it comes to my health or a procedure that I'm going through. I want to know what's going to happen. So definitely go check out those 2 videos after this one. And then, okay, a couple more questions. Okay, so this one is in regards to BIALCL, which is breast implant associated anaplastic large cell lymphoma, which is an immune system cancer that a lot of women, I mean, not a tremendous amount, but enough women are getting from breast implants. So if it's really important to you to get tested for BIALCL, you want to ask your surgeon, do you test for that? It's called the CD30 test, and it should be done at the time of your explant. If you have any symptoms of BIALCL, such as redness, itching, swelling, hardness, pain, anything along those lines, and you just want to have that peace of mind again, knowing I don't have it, definitely make sure that your surgeon can do that during the time of your surgery. And then 2 more questions. So, you know, when you are getting ready to have your surgery, you know, does your explant surgeon offer any kind of pre-op care package? Like, when should I be starting the arnica? When should I be stopping my medication? What supplements should I be avoiding like before my surgery? When should I stop smoking cigarettes if you smoke cigarettes? You know, all of the things, again, just so you know the time frame of when you should be starting and stopping anything so that your explant surgery is just done without any hiccups in the way. And then the last one, and this one is so important and it's often overlooked, and that is, what does it look like after I have my explant surgery? Like, do I get a hold of you personally? Do I get a hold of the facility and like one of your nurses? Like, what if something happens and I have an emergency like question and I feel like I need an answer today because I'm not sure what's going on with me? Like, who do I get a hold of and how do I get a hold of you? Because I can't even tell you how many times over the last 4 years women have gotten their explant surgery and then they get like the runaround after their explant surgery and they're dealing with like rashes and infections and seromas and they can't even get a hold of their surgeon. I feel like, yes, it's so good to make sure that you're picking out a really good surgeon, you're doing your explant right, but also during that really critical healing and recovery time, how do you get a hold of them? Do they offer their personal number? I feel like having that clarity on that is going to make such a huge difference, because if they're like, oh, you know, we'll just check you out on your 1 week update, you know, don't really get a hold of us until your 1 week update, or don't really get a hold of us for this, or, you know, it's just like, not really too comfortable with that. I'm probably gonna need some hand holding after my explant surgery, and it's going to give me peace of mind and comfort in knowing that I know who to get a hold of. And like when I ask a question or a text or a phone call, I'm gonna receive an answer within 24 hours or by the end of the day. Those are like the most important questions. Now, if you want the entire list of questions, there are 40 different questions in here, and some things might be important for you to ask that you might not have thought to consider to ask, such as like your stitches, or do you offer nerve block, or like what kind of medications am I going to be on because, you know, I have this condition and stuff like that. And if you're wanting to know about lymph nodes and muscle repair, just those kinds of questions, they're all here for you inside this guide. It's called Discovering Breast Implant Illness, What Now? I will link it down below. And what I would recommend is doing like I did and downloading it, printing it out, and taking it with you to your explant surgery consultation, and just, you know, interviewing that surgeon, because they're going to be doing this really important job on you, and you want to make sure that you're choosing the best of the best. Now, to be totally transparent, this guide is a pick your price guide. So what that means is I didn't set the price to like $20. I wanted to allow for you to be able to donate or contribute whatever you feel called to contribute to get this guide. So if it's $1, awesome, appreciate it. If it's $20, awesome, appreciate it. And also, there's not only the consultation questions in this guide, I also go over post-op care, like what you can expect with post-op care in regards to like when you can typically take a bath or pick up your baby or drive your car, exercise. There's all those kinds of questions in here as well. And then I also did include my personal favorite detox and immune system boosting supplements and techniques in here as well, just to help you get as strong as you can and as healthy as you can before and after your explant surgery. Please consider subscribing if these types of videos and topics on breast implant illness and explant surgery preparation and recovery are of interest and of value to you. It would mean the world to me to have you as a subscriber, and I will see you on next week's video. Bye.